When we move on to a gait assessment, I'll do this in walk and trot and also do some tight turns. But in walk, we see from 3 different angles. So we have the horse moving away from us, which is where I'm looking at things like our tail position. Is it held straight or off to one side? The pelvis movement as well. So is it rocking forwards and backwards more on one side or up and down more on one side? So always looking for symmetry. And this can be really difficult when we've got a coloured horse. So the white patches versus the darker patches can sometimes throw your eye off and make it seem more uneven than maybe it is. So you've got to try and train your eye or be more familiar with that type of horse to get a really good read of them. And I'll also be checking if the limbs are moving straight. As the horse comes past from the side, I'm looking for tracking up. So have we got good length of stride in all 4 limbs? Also looking at our joints. So do we get even flexion and extension through our joints? And also looking at something called the fetlock drop. So this tells us how much weight is being put down at a particular limb. And then the more that the fetlock drops to the floor and sinks, the more weight that is being put through that limb. So it can help tell you whether a horse is overloading a certain side or a certain limb as they walk past. From the front, I'm going to be watching the head and the neck. So is the head and the neck held straight repeatably? So I usually do this for quite a while to get a good reading on if things are repeatable. And are the limbs moving in that sagittal plane? So nice and straight in front of the horse without deviating round in circles or landing to one side. Also checking the hoof wear and making sure it makes contact with the floor evenly. I also do the same in trot. So as she trots towards us, what's the head and neck doing? And most of the time, the trot just tells me what I already know in the walk. So you can see there a little bit of stiffness in the trot from the lateral aspect. And as we move on to the circles, we do left and right circles. So everyone always thinks that these are to do with if the horse can cross the hind limbs over. But actually, I like to think of it as, can the head and the neck move and bend? Does the back follow that bend on that turn? And then looking from the feet, not just can the limbs cross over, but what is the rhythm like as the horse turns round? Is it a nice, even 1, 2, 3, 4, 1, 2, 3, 4 rhythm? Is the good foot height? So is the foot picked off the floor evenly, or is it twisted and turned as we go around? And also, is the placement of those feet correct? So are the feet placed in the correct position? So here we can see a little bit of stiffness through the neck, and then we're moving backwards rather than forwards. So our placement and timing is a little bit off. We'll bob her back. I'll do her neck first, and then she can have a little look out the window, can't you, sweetheart? Good girl. Yeah. A lot of them can be, and sometimes it can be these, and sometimes it can be like around the poll. It can be quite sensitive. Oh, sweetie. Good girl. Good girl. Good girl. She just get a little bit tight up there, doesn't she, as well? Doesn't feel sort of swollen or inflamed or anything hot, but you just get a bit of blinking there, where you just get a little bit of a release, and that's just pure hand pressure, like just the heat from your hand, and almost like the weight of your hand as well. Good girl. And you just make small little circles. Good girl. And it just releases. Though it's a little bit like the computer centre, I always think, the poll. You've got lots of different lines of muscles that all sort of come together around that area. Okay. So that's why essentially we have tack there. You know, it's very good for control because you're pressing on lots of different sort of sensitive nerves and different, like I said, control centres for all the different muscle chains in the body. So if you've got tension in the poll, little chew there, it can feed down into your head and your neck. It can feed from one side to the other. So if one side's tighter than the other, you'll get problems, not with bend as such, but more with flexion. Okay. And then up there, you've also got the attachment to the skull. So you've got your yes and your no action. So if you think of that, if the horse can't flex and extend, it's going to be quite hard to eat out the hay net, reach down for grass and flex around that area. And also if they can't move it and stretch it, you're going to get more tension and more resistance. And if they can't then bend, it has to go elsewhere in the body. So it'll either be additional bend and strain on the neck, or the back and the ribs, and they start twisting. So then you start getting a bit of a head tilt. You usually see it as a head tilt. You sometimes see it as that as well.
So is that something I can do?
Yeah, there's another way which you can, which is easier, but if she doesn't like her ears doing, she might not like it. where you get the base of the ear, so right on the bottom, not sort of the actual ear itself at the top, and make little circles. So you've got 13, 14 different muscles around your ear. So it's really important you use the base and not the top of the ear because they can be really sensitive. And I'm just rolling the ear round, and you can see as it's going, you get a little bit of pull on your temporalis muscles on the forehead, around the eye, around the jaw, and your masseter muscle, and then your poll area. So as you do little circles both ways, so I'm not gripping, I'm just sort of cupping it a little bit, and then rotating, and you get a lot of release through her eye. So that's like an indirect way of doing it. If she's not going to tolerate the hand pressure on the poll, that's a really good way of seeing where the tension is as well. So she's not really reacting as much on her forehead. When you come forward there, you're getting a little bit more. And it gets a little bit easier the more you do it. So initially it can feel a bit stiff and a bit tense. And then we'll start to loosen up a little bit. And she's got softer eye now. Good girl. I think the head and the neck sometimes gets a little bit forgotten in terms of horses' backs. We tend to always associate it with the back. I mean, like years ago, it was like the back person, wasn't it? Always. So it wasn't the head, neck, and legs and back person. It was just the back person.
Just the back, just get to the back man.
So you always think about it being backs as the issue, but like I said, your heads and your necks are quite important as well. So you sometimes get a bit of tension along your facial crest here as well, which again feeds up into your jaw. So your TMJ is here, and sometimes if you get buckles on your bridle or tack or anything pressing there, you can get a little bit of pain. And again, things like head tilting, twitching, head shaking.
Because I wonder what she, when she wears a turnout head collar all the time.
Yeah.
I mean, it's not time, but she can be quite tense around her head. When I head collar her and things like that.
Yeah.
And I think sometimes when she charges off with a head collar, when she snatches it out of my hand, I think that's possibly because she's sore.
It can be, and you think, it's such a sensitive area, but it's where we always have tack, don't we? We have bridles, we have head collars, and she does react to something pressing there because it does get a little bit sore. We'll see what she's like on the other side and see if it's the same or different. So I've just had a feel of a masseter there as well. So this can sometimes help with knowing if you need the dentist.
Right.
So they'll either get bulging in your temporalis muscles at the top here, because this links down into your cheek muscle. Okay. So if they're not chewing properly, not using the big cheek muscle on the side, then they start to strain on the top, and again it feeds into that sort of ear circle of tension. So bad teeth can lead to obviously TMJ pain and jaw pain, but it can also lead to like pollen, neck and head tension as well. Same in us, isn't it? If we've got a bad tooth or we've got pain, it affects everything. It affects your balance, it affects your ears as well sometimes. Oh no, toothache and foot pain, I think are the worst. Okay, so again, just check up that facial crest on that side. You sometimes get knots and trigger points up there as well. She's not got any of those. She's just a little bit tense. And again, we'll have a little look at the top.
That's the ear shape of circle, so she's a bit more. She's due Hickey in February.
Yeah, so she's due a teeth. Yeah. That can, like I said, that can feed into things as well. We often think of things being in isolation, where the teeth are separate from the bending problem potentially we have in the school, or the tacking up problem, but it's all linked. All linked, yeah. They don't know how to communicate in our words and say, I need my teeth doing, please. They just do a behaviour, and it can be the strangest behaviour sometimes.
People just assume, don't they, that if they're naughty, then it's the back, it's the back, it's the back.
Yeah, or people say, the back's been checked, but has the saddle also been checked, and has the feck been out? And
has their teeth? Is she ready?
Yeah. And how many people actually know their horse's normal range of motion? How much should their back go up, and how much does your horse back go up? Because I think as well, become a little bit. We know our own horses, but we don't know whether it's normal compared to the wider population.
No, and I think sometimes that's why it's particularly good to.
Okay, so the next to the other end. So we know that she gets tight at the poll,
and
then you've got your long neck muscle that comes down. So the other end of that attaches to your forelimb. So if you've got tension at the top, you generally get tension at this end as well. And because it's so long and it's used to propel the limbs forward, sometimes if it gets tight you get a reduced stride length or choppiness in front.
Okay.
And if it's really tight, the leg can't come back. So you get really short, like I said, short strides in front without a full swing forward and back from the leg. And again, sometimes you get little knots and little trigger points in there that just tie up the muscle and stop it working as it should do. Shouldn't feel too bad.
Is she alright now?
Yeah, she's fine. That's why I did the neck first, because you just think, well, let them crack on with it then. You can crack on with your hay, can't you then?
Her actual hay's outside of. She can have that when you do that.
The pecs sometimes get forgotten as well. The pecs on the front, I always think they should feel like silky fish in a fish market.
Silky fish.
Silky fish.
Hers are quite silky.
Yeah, they are quite silky. Sometimes you feel like little grains of rice in there, and they can get a little bit gritty and a little bit overworked. Or you can see them bulging quite a lot sometimes. If you've got horses that lean forward onto the pecs, they almost sink and fall flat onto the bottom. Yeah, so if they've either had like a hind end injury, or if they're on the forehand quite a lot, or they struggle to lift the neck up, you get this sinking and flopping down onto the front. Good girl. And again, if they get tight in here as well, you know, it can make them more narrow. It can really restrict them in terms of like lateral movements or just mobility of the forelimb and the shoulder. Oh, she's so good at communicating, isn't she? She's gone really from one extreme to the other. Like, I don't want that ear touching, but I do like this.
Yeah.
In behavioural issues, I think they're just very misunderstood. And like I said, they don't communicate the same as us. You know, they might have some weird and wacky quirk, and it's their way of going, I don't like such a thing happening, and it's either stress or anxiety or pain somewhere, and we might not be able to find it. But no, it's very rarely naughtiness. I don't think as humans we like to admit that a lot of the time, though. I think we like to think we're doing everything we can, and we don't like to admit that sometimes we don't always have the answers. You know, maybe things are too deep to find, or they're so subtle as well. I mean, some horses will really kick off at something really minor, and some will be so stoic that it's only when things are really bad they show it. Yeah. And how do you work out if your horses are, you know, a little bit of a hypochondriac on the scale, or whether they're really stoic and just get on with it? So most of the job that we do is just feeling the horse and giving almost like a problem list and saying, well, these are the things that are niggling her today, and this is what we do to try and work on it and to help it. Okay. You know, are they symmetrical on one side to the other? And she's got good muscle tone over her forelimbs. Just have a little check along the back here. She's got a good muscly back, hasn't she? And she's not necessarily got any pain in her back, but there are some spasms in her ribs.
Right, okay.
So in between those ribs, there's just a little niggle there that if you press a little bit, you'll see. So if you find sort of in between your ribs and come up, she just seems to be more reactive there on the shelf than the actual long back muscle itself. Good girl. So if anything, that'll be affecting more of her bending. See there, she goes a little bit tight here. So do it again there. See it rippling?
Yeah.
So she's got a little knot there. And again, I can feel her breathing change as well. Sometimes just hold the breath. Big one there, feeding forward. So it's almost from this back section of her ribs, feeding forwards under where the saddle sits. So it's not even always this part of the muscle that's affected. It can be coming from somewhere else, because the muscle spans under your shoulder all the way along and into your bottom. So anywhere along there could have a little knot in, like there. And you see the tension comes up and round and right under, like I said, where your saddle sits. So if she's struggling with backlift, it's not always there. It can be a little bit further away. Yeah.
necessarily wear her saddle slips, is it?
No, no. I mean, you know, it's always worth checking anyway. So that's why we say, you know, last rib and the curve
Yeah.
up. So that's where the last point where she should have a saddle. But she has got a little bit of longer back, hasn't she? So she's got a good length of back to carry a saddle.
She was quite difficult to get a saddle for that fit her and me because she's quite wide across the back and quite flat. Yeah. I needed something that I could fit into.
Oh yeah.
And she's in it's a 17.5 inch kind of nasty dressage saddle. But it's due to be checked in the veg.
Yeah. So your regular saddle fits are good because they do change shape summer to winter.
Yeah. I always
As
would
well.
kind of springtime then when she's coming out of winter.
That's why it's so important because you've got. So she's got tension in her back here. It's not necessarily from the saddle. It can be from her. It can be from riding.
Yeah.
You know, we're wonky as well.
I guess it could be through lack of work as well.
It
She's
could be
not
through
done a
anything.
lot.
Yeah.
She's not done a lot recently at all. The ground's been awful and turnout's taken priority really.
Oh yeah. You know, I think it's one of them, isn't it? Some horses enjoy having some time off and they almost reset themselves, and others will have compensations that come to light and they almost get worse.
Yeah.
And that's why I think sometimes just dropping horses off and retiring them to nothing isn't the best for every horse. Some of them need a little bit of support and say, you shouldn't really be walking like that. You know, like I was saying before, the pecs, you know, sometimes they shouldn't be walking so much on the forehand. They should engage a little bit behind to keep muscle mass and keep muscle tone, you know, keep things working as they should be.
I mean, I intend to do as much with her for as long as I possibly can. Because I don't think she'd take to be retired in the field very well. I think she will still need to do something.
Well, horses have changed now as well, haven't they? Do you know, it used to be, I think it still is on insurance policies that 14 is aged, or 15 or something is aged.
Veteran, isn't it?
Yeah.
Policy now, because you're 15.
I mean, horses are, you know, 9 and 10 is like their absolute prime, and they're just about getting going with the ridden career, a lot of them. And, you know, they're living so much longer and they're being ridden for longer. And we know so much more about keeping older horses happy and healthy that, you know, it's not really old.
She really didn't mature until she was about 8.
Well, big horses do take a bit longer as well.
She's warm blood, isn't she? So
yeah,
I really think because she's crossed with a cob or a draft, these knees and this head. Certain people pushed her because she was big and strappy and big.
Yeah.
But she wasn't mature.
Well, no, because the spinal fuse, you know, 7, 8 years old.
She wasn't mature, and
so
she, you know, for a couple of times when she.
Oh, I'm just getting some of these knots out.
She's just seen the camera.
Oh, is she? Are you having a sniff? There's a few ways you can get rid of them. I mean, heat's really good.
Right.
Like I said, if you've got a massage pad, that works. Your hot water bottles work well.
Okay.
You can just do, like, it's called ischemic pressure, which is what I'm doing there, where you just raise it. So you just put a little bit of pressure through to get it, and you push all the blood out of the knot. So it stops it being able to work.
Okay.
And then I'm going to hold on for about 30 seconds to a minute. That's what it usually says. It's usually a little bit longer. And then when you release, all the blood rushes back in and you can reset it a little bit. So I find that's normally quite useful. And also because it's near a ribs, we can press on the actual rib and bounce the rib and use the rib itself to move the muscle. So it's a little bit like chicken and the egg. Is it the muscle in between the ribs causing the ribs to be stuck, or is it the ribs that are a little bit tight causing the muscle?
Okay.
So I do both. And then we get rid of both, and it should feel a little bit better, a little bit more springy. Okay. The easiest way to do the ribs is just to find that shelf, so just where the ribs start there, put a little bit of pressure down and just really gently bounce on them, and they should have a little bit of give. You're trying to witch into me. Good girl. So for such big animals as well. It's feeding back a little bit further into her hips as well. So you've got a bit of a band there. Quite normal, I think, for a lot of horses to have sort of tension there from the back of these ribs and then that space to a pelvis. So just along from where your tubercoxy is here up, you get a little bit of tension there, which again, when you press it, we get like a little bit of an arc. And she holds a breath, and again, it's feeding right under your saddle area, so you can see that.
I can see that.
A good foot away, all the way down there. So again, even tension coming from this back leg is feeding forward into why she can't lift.
The one that Ruth has to get underneath and
so this is the one that she's had the old injury.
And
like you say, if she's had a stifle injury, you don't get the propulsion and the push.
No, and that's what it is.
Yeah. But then she's getting tense as well, so she's bracing against this left leg. So then when you're asking her to push, the energy almost can't come up and over her back because it blocks. Yeah. Oh, she's leaning into it. Oh, she's a good girl. Oh. Oh. There's some of them like it really, really gentle, and some like get in there.
I quite often groom her with a mane and tail brush. You know, give her a really big split.
Oh.
Loves it, don't you? And a nice little scratch with Becky.
She's a good girl. But you can do quite a lot for that sort of tension as well. You can either put some K-tape down, so some people put a bit of tape down, a bit of sports tape, and that'll sometimes help with like your trigger points or tension by lifting the skin and the fur up, up and over.
I'm very sensitive.
Oh yeah. To again give a little bit of space, that blood flow.
Yeah.
Oh, sweetie, good girl. Yeah, hamstrings are another one. So you've got almost like a brace in between your quadriceps at the front, your hamstrings at the back. And if both of them get tight or restricted, then how's the hind leg going to move?
I do a hamstrings like that.
Yeah. Just give a really good.
With the heel of my hand.
You've got
She likes
your hamstring there, so you've got semitendinosus there. I always think of semitendinosus as being a long tendon type structure, and semimembranosus, which is like a membrane on the outside, and it goes more medial to the inside. And then your big inside thigh muscle is gracilis, so that's the one for your lateral work. So it pulls the leg in.
That's the one that I need to.
So you've got that one that pulls legs in, and you've got the TFL and the biceps femoris, which is round and wraps around here, which is your outer thigh. So they've got to have balance between them. So you've got the front and the back muscles, then you've also got your in and your out muscles, which, like I said, if they're tight, the limbs aren't going to track straight.
No.
Start off nice and gently. I wouldn't go straight into this first and put your hand right on the inner thigh. It's not the nicest thing to go and greet somebody with.
No.
But you work up to it, and then you can really start to get a bit more blood in there. Sometimes you can use like the edges of your hands and just do a little bit of like a cupping action, and that can get a little bit of blood flow in there as well, because it's quite a meaty area. There's a lot of muscle there.
I have to be feeling quite strong to.
Yeah, you've got to have your Weetabix.
Especially if I do both sides, obviously, which I do. By the time I've done the second side, I'm a bit like, oh, my hands are aching. Nice, you're enjoying it.
But this feeds down as well, so you've got your big Achilles tendon at the back, your calcaneus tendon, and it all feeds into that. So a lot of the muscles of the hind end come down and feed onto that tendon, onto your hock. So if the muscles are tight above that, we always think as tendons have been a separate thing, but they've got muscles attached to them. So if the muscles are tight above it, then the tendon's going to be tight, and then your joint's going to be tight. Good girl.
You will tolerate that all day long.
A lot of them quite like it. They do generally settle into it. And like I said, they're all different. Some will prefer really slow, just fingertip pressure.
Yeah.
And you can find, it almost feels like little bands of spaghetti or grains of rice. And you'll come down and you think, well, my fingers have just hit a stop, where it can just be a little bit tight. So you can either do finger pressure, or if, like you say, you can get in a little bit deeper, really give it some relish.
Strapping, just a proper groom to kind of get a blood flow going and get a skin healthy.
see, sweetheart. So if we're checking, like I said, the leg will go different ways depending on what's restricted, so you can test it. Doing some little circles. Steady, steady. Good girl. Do some little circles in and out. So she seems easier on the outer circle. A little bit coming across and in is a little bit restricted. I'll try coming back. Yeah, try and keep it a bit lower. Good girl. Good girl. But she's got an injury there as well. It's easy to just keep it a bit lower. A little bit of time. I need a bit of patience for this. We've just got to sit and hold. I like to lean on my knee sometimes as well, and I can just be quite stable there. I think if you move around a lot, they feel a bit unstable and they don't particularly like it.
You need to stay where you are, don't you, compared to...
Yeah. Sometimes people put like just a hand on there, but I think the temptation, if you're not sure, is to grab or to push or pull, and you don't really want to. Okay. I'm just going to guide. There we go. Nice big release there. So she comes down. See if we can get another one. Trying to keep the limb nice and straight. She'll just guide down again. My feet are well out of the way as well. Don't particularly want standing on my toes. Just a little bit steady. You've almost just got to act like you've got all day. There we go. She's got more in the tank there. We have got more in the tank. Good girl. That's good for her. That first one was nice. You just had that extra little bit of a drop.
Just give it a bit more of a...
So if we come forward instead, we should aim, ideally, for your carpal joint. Now this will be, if she gets tight hamstrings, this will be a little bit harder. Again, I'm just going to sit and wait. Some people put the knee under, but I've got wonky knees, so I'm not very good at doing that. Again, just trying to sit. See how far we can get. And I usually measure it in hoof distances. How many hooves are we off? So about 2 hooves off there. And we can check the other side and see if she's the same. Good girl. Same with that, you can take it back and forward and you can go in and out as well and sort of do a bit of lateral movement with those legs. But we'll see what she's like on the other side. Oh yeah, I'll have a feeler for the other side first. I'll do this front leg while we're on this side. And at least we've got one side mapped out. So I'll do flexion. Rotation.
This side is her stifle injury side.
Yeah.
So that you would expect her to be better on the other.
Well, she's probably going to be stiffer on the other one.
Think.
If she's weaker on that stifle on this side, she's probably going to be overusing the other side but stiffer.
Okay.
So it'll be stronger but stiffer. Let's see what we get back. So if we struggle with this, it might be the base of that neck. She didn't seem too bad, but she pulls a little. Good. And keep legs straight and just guide. Okay. Good. A little bit restricted in a carpal joint, yeah. Look at her elbow. Shoulder. Good girl. Oh yes, we're doing that one next. So pop your back. Because you've got long legs. Long legs, girly. Have a little support there and see. Then keep straight. Okay. Now you want that elbow to drop. There we go. There we go. Good girl. Good girl. She is. She's a good girl. Yeah, we'll bob her that side and have a little look. So we've got an idea of that side. And we'll see how we cope with this side. Good girl. Oh yes. And check the base of that neck. She's tighter on that side. more up into my shoulder. And more grainy on this side of her pec. So she is sitting on this leg a little bit more. Good girl. She's an angel, isn't she? She's a really good girl. She loves the pets being done, doesn't she? You learn so much about them doing this. You're like, I know all the tickly spots. All the bits we like. Oh yes.
Home bargains and get you some big long ones.
So that's another little area there you get under your
Where
girth.
yeah.
Now your girth up on the other side.
Yeah, I do.
So it's not going to be the girth necessarily, it might be your falling restriction. Like I said, if she's stronger on this side and using this side as a bit of a pogo stick, she'll brace, and sometimes the shoulder can get stuck to the body wall.
Okay.
So you've got your serratus muscle, which sits on the very deep on the inside of your shoulder, and it helps stick the shoulder to the body because they don't have a neck bone. They don't have a clavicle.
No.
So they don't have a bony attachment. So it just
It's
swings. So if that gets tight there, which sometimes you see with your deep pec, right on the inside of your shoulder, either at the front or the back of the shoulder, it can brace your shoulder, and again lead to that lack of falling range of movement. So if you've got that and a tight front of the neck, you're going to really struggle to retract and come back and get that stride length and bounce to come forwards. Good girl. It always surprises me. You always think it's going to be where the injury is, or that's the bad leg, and it's.
When you kind of mention, you throw the word compensation in, they're going to compensate with their better side, aren't they?
Absolutely, and sometimes the better side always seems worse in terms of it's less flexible, but quite often it's more muscular, it's stiffer because it's stronger.
Yeah. So the compensation comes with the strength, doesn't it? Because they have to be stronger to compensate for the weaker side. See, all makes perfect sense, Dawn.
So I'll give her a bit of a massage this side, and then we'll try and do a little bit of a belly lift. And we'll probably see a block here, because that's where she's got the tension, and a block here.
Okay.
So if we were doing some carrot stretches with her, which would be good for her, she'll probably find nose to chest very easy.
She does.
Because it's just your wither lift.
She does. She finds it really
Nose
difficult to get back
to
here.
her front knees, carpal joint will be tricky because that's where she's got the restriction, and there's no point getting her down to fetlocks because then you've got to go through that to get to this. So she'll probably be better doing nose to carpal joint.
Yeah, she's. I mean, Hannah always laughs and says, "Oh, Dixie's more flexible than Storm." She is in some areas, because if you put a carrot on Dixie's hip and you get it, she struggles with that.
Yeah, but we know her restrictions are in her ribs. So between those ribs, especially sort of the back half on this side, back third on that side, she struggles to open the ribs and actually, she bends through her neck. You don't get a lot of that bend through the ribs, which is what she needs to work on, and that should unlock a little bit more mobility for you. I'm just going to put some, I've got some infrared and red light, I'm just going to put on that side because it's just a little bit more niggly. The other side came out quite well. Oh, very exciting. It does have a bit of a beep in it.
Alright, she should. We have a very good one all the time, don't we?
Yeah, I'll try and catch it before it does beep. So it's, as I say, it's a bigger laser head with red and infrared on it. Good girl. Pop that on there.
Oh, there's a cat here now, look. Hi, you've got food. You've just chosen not to eat it this morning, which is your silly fault, not mine.
Good girl.
Enjoying it.
She's a good girl. Oh. Clever girl. It just helps get a little bit deeper and just helps get a bit more blood flow. It can help with a bit of pain relief as well, especially if it gets tight and tense. You get that sort of myofascial pain, and it's like an ache. You probably felt it, you know, if you get a little bit of muscle pain and you can't quite find out where it's coming from. You think it's just in this area, but I don't know where it's coming from. Just a bit achy, that's what they'll feel. So it just helps get a little bit more of the blood flow in that area. It helps save my hands a little bit as well.
Your hand must go through hell.
Good girl. I'll catch it before it beeps. Good girl. Oh, she's so clever. She's like, oh. Just have a little reassess again. She's so clever. Still got a little bit coming from that lower back. Again, it's probably coming from this restriction in her back legs, where when we took them out to the back, you wanted an extra sort of foot behind her to really extend her hips out. But again, she can't. If she's tight here, how is she supposed to move her pelvis up and down? You know, things like your canter's going to be hard, especially. Because that's when you get your pelvic tilt and your sitting forward. It's all about that transfer of energy, isn't it, from the back end up to the front and over the back. Good girl. She's a really good girl, isn't she? She's the best model patient. Good girl. Oh, no, it's just sometimes it's good to have a bit of freedom, because you can actually see what the body's doing, the rest of the body, and the weight shifting. And I said, without sort of going through everything, let you watch what her eyes are doing, her ears are doing, her breathing, her posture, you know, how she stood, where her weight is. There's lots of little giveaways that you've just got to be watching for, because they are quite subtle.
Yeah, and I think because I've had her so long, and because I know her quite well, I notice when she's not quite as she should be.
Yeah.
I know when she's not stood properly, and I know when she's the other day, they scare you, don't they? The other day she was taking her hay out, and she was doing it all like sideways, and I was a bit like, what's going on with your teeth? But
yeah,
I don't know whether it was just a particularly fibrous haylage, and she was having to pull it at a different angle to get to it. She's not doing it.
Yeah, it can be anything, can't it? And like I say, she's definitely tight on the right side of her poll.
Yeah, she's due
as well.
In February. It's booked for the 23rd, I think. That again, that's traumatic.
You sometimes feel as well, so if you get the bottom jaw, your teeth should sit in between two rows of top teeth.
Right.
So I'll just wait till she's finished chewing. You should hear like the teeth click both sides, like, and click against the outer set.
Okay.
So you should get clunk. Not so much on that other side. So clunk. Can't quite get her to come over and hit. I'm getting this side. I'm getting her right side, so she can hit the bottom jaw against the right side, but not the left. So whether she's tight on that right, and she can't release it to come over. And that was the tighter ear.
Right.
So it'd be interesting when the dentist comes up to see her teeth. What she's seen a couple at the minute that we work together with, and similar. So she'll test that as well.
Yeah, I'll ask her to. I mean, she'll be sedated.
Yeah, you might as well when she's sedated. It's a bit easier. Have a look at this back. So you can almost tell what's going to happen with. Easiest to come up round her with her. And then, we hardly get any movement there. Oh, see a spasm, you've got to go, I can't quite do it. A little bit. Let's come down and try again. Just move her a little bit and try and get a bit more flexibility in the back. Good. It's okay, it's just a reflex. I think it looks worse than what it is. Good girl. Good girl. Getting a little more. That's it.
She's not bothered by it at all.
And then we got either side, so she's better doing it sideways there now.
Yeah.
So once the ribs are a little bit more open, we get some more lateral bend through them lower hips. It's just here, just where you sit, Jean. Just the prime candidate of where we don't want her to be stiff. It's not that. I think it is just the fact that we ride them and they do get stiff there, and the backs are quite solid. Good girl. And again, we're getting a little bit more there. It's coming. But this is why doing the carrot stretches to them front carpal joints need to target this area to really get it. Good girl. So you've got a little bit more there. Her hips, she's already fairly extended. But we can go up and down and see if we get a little bit more. Go on, go on, go girl. There we go. So she can tip, she can move those hips a little bit now. So we've got, that's your canter motion. That flat and up and flat and up. That's your canter motion. So it releases some of that tension. Yeah, like I said, she's still got a little bit of tension there. Just try and release it off and make a stretch through this side. And she can do it, but the tension is still there.
So is it pain or is it?
It's a bit of both. I mean, wherever there's tension and restriction, there's going to be a bit of pain. It's like us, if you get stiff, don't you? Yeah. And it's how much they can cope with. But in an ideal world, like, you'd just help them. You know, we know that that's hard for her. So if she can't lift up there, how is she gonna come round? Because as soon as your back comes up, the head's going down. And that's what you want. And then your shoulders come up and then we're not leaning on the pec. So you want this nice, when we say the horse is working over the back or on the contact, we mean the back's lifting, the back is coming up. And if it can't, it gets stuck. That's actually a bit better. And it's usually this midsection where they get a little bit stiff and stuck. She's still a little bit high there, but that's miles better. And again, the next one down. So I'm just finding each bone at the corner of my hand. Miles better. Miles better. And then last one down. Steady. And then just get a little bit of a bum twist there. So that was a little bit hard, but that was miles better that other side. Yeah, when we're doing the tight turns, we already knew that because you could feel it on the tight turns. Good girl.
Yeah, that's amazing.
So for her, I'd be doing the pole stretch.
Yeah, this one.
Yes, so come in and then up a little bit and stretch up there.
Yeah,
She's still like, oh no, not that. You can do it yourself then, can't you, my dear? I'd be doing lateral carrot stretches, or if you feel confident, you can do it with your hand, just like I was doing then. So little finger pressure there. Feel for each of your bones. It's easy if you give it a bit of a press and use the heel of your hand, and really you cup them a little bit as you come down. So they follow that S shape.
Okay.
Yeah, just find one, cup, and then just almost put a little bit of pressure again. Yeah, like that. little bend. The next one down, bend. Next one down, bend. So you're just having a little bit of lateral movement against your hand on both sides. That's the easiest way to do it, to feel, because I think if you do a carrot stretch round,
you can't feel it, and they can change, and they cannot.
She'll probably cheat.
She does cheat. We'll try, but she does cheat.
Yes.
I'm not gonna lie.
We do a little cheat, don't we? And it's easiest for them to cheat because they can twist and you can't really do anything about it. This area, you could do some lifts, so you could just draw your fingers under, or just do carrot stretches down to a carpal joint, and she will do it herself. Easiest way to do it. Path of least resistance. In terms of like a lower back, definitely heat, and you almost want the hips to do a bit of a boogie woogie dance. So lots of suppleness and
so lots of that, lots of heat and lots of that.
Turn on the forehand where she's stepping and crossing and bending, and lots of circles to get the hind, almost ride it with the hind end, So she's coming round and swinging her bottom.
Yeah, so we do that in the saddle, can't I?
Yeah, you can do it in the saddle. You can do, like I say, your tight turns where she's bending one side to the other.
Yeah.
Or again, you can try your carrot stretches round to the side, but to get here, she's got to come quite far.
Yeah, she struggles. She gets to about here and then starts waggling.
At the end of a session, I also like to make sure that I watch the horse move again. So I'll always watch them move at the start and at the end of the session to be able to see any changes and if it's been a good session or if anything has come to light or not resolved the way I would expect. So usually if horses are compensating quite a lot for an injury, having some manual therapy and some physio can sometimes make them a little bit sore and a little bit worse, or you can see some of these issues come to light following a session. So same things I'm looking for again. So as the horse moves away, again, symmetry, straightness, the overall sort of bounce and sound the horse is making with its hoof contact on the floor as well. And then we'll usually have a trot and still do the tight turns just again to see if we've got any difference from before and after. So we can see as Storm's trotting here, we're still getting a little bit of toe drag and lack of flexion in those hind limbs, and we know that she's had a previous injury to her stifle as well. So this isn't a new finding, it's something that we're quite aware of with her. Again, just making sure we check to make sure it's not got any worse following treatment. Make her do a couple of passes just so you can see. One of the nice things I think with her after the treatment was her turns. So her left turn here, you can see there's a little bit more of that neck bend and back bend following her round onto that circle. And not only are we getting a little bit more crossing through her back legs, which I said wasn't the only finding we look for, but the foot height and placement and rhythm overall just seems a little better than those ones that we started with. Any questions, let me know.